This is an introduction to liver cirrhosis, the causes, the complications, and the prognosis. I would like to begin by giving an overview of the digestive system. When we eat, food enters our mouth. The food travels down the esophagus and into the stomach where it is stored. From the stomach, the food enters the small intestines where it is digested and absorbed into our bloodstream to provide nutrients to our body. The digested food then enters the large intestine, or colon, which removes water and stores stool until it ultimately exits the anus. During digestion, a significant amount of blood pumps through our digestive system to gather the nutrients. That blood then returns to our body's filter, the liver. The liver is a large organ weighing about 3 pounds. It is reddish-brown in color, and when healthy it is smooth and rubbery feeling. It usually cannot be felt as it is protected by the rib cage. The liver filters the blood coming from our digestive tract and helps us process the food we digest. Other functions include the making of proteins, which help our blood to clot, as well as detoxifying chemicals and metabolizing drugs. In other words, the liver has many functions and it is critical to our well-being. The liver can be damaged. The two most common reasons for damage are either heavy alcohol use or the viruses known as hepatitis B and C. If the damage continues, it can lead to the potentially life-threatening disease of cirrhosis. Cirrhosis is the term that describes a scarred and damaged liver. As you can see, the liver with cirrhosis, or cirrhotic liver, is not smooth. It is nodular with scar tissue throughout. When the liver is cirrhotic, it can cause many problems as it no longer functions well as a filter, nor does it adequately produce many of the proteins our body needs, and due to increased pressure, fluid backs up, causing swelling in the abdomen and legs. To further explain, patients with cirrhosis can have many problems, including decreased protein production. Our liver makes many proteins, but some of the most important are the proteins that keep us from bleeding. People with cirrhosis tend to bleed and bruise more easily. In addition, cirrhosis hinders the liver's ability to filter. When the liver is not filtering well, we can become very tired and confused to the point of being unresponsive or comatose. This is known as hepatic encephalopathy, and it occurs because the liver cannot break down the toxins in our blood, such as ammonia. Cirrhosis also hinders blood flow. Due to the scarring and damage, blood backs up, causing increased pressure. Due to the increased pressure, fluid leaks into our abdomen, which is known as ascites, and in the legs, which is known as edema. Not only does the increased pressure cause fluid buildup, but it also causes blood vessels to enlarge. These are known as varices, and a common location for varices is in the esophagus. Varices can burst and bleed, causing one to vomit blood or to pass blood in the stools. The prognosis of cirrhosis is highly variable as it depends upon the etiology or cause of the cirrhosis, the severity, the presence of complications, and comorbid diseases, which are additional chronic diseases such as diabetes or heart failure. In order to help determine prognosis, cirrhosis is divided into two categories. First, there is compensated cirrhosis, which includes patients with cirrhosis who have not developed any major complications. The prognosis for patients with compensated cirrhosis is a median survival of greater than 12 years. This means that about half of all patients with compensated cirrhosis will die within 12 years, and half will be alive at 12 years. Second, there's decompensated cirrhosis. These are patients who have developed complications of cirrhosis. Discussing these complications is beyond the scope of this presentation, but they include variceal hemorrhage, ascites, spontaneous bacterial peritonitis, hepatocellular carcinoma, hepatorenal syndrome, or hepatopulmonary syndrome. The prognosis for decompensated cirrhosis is much worse, and depending on the complications which have developed, survival expectations can be as little as 6 months. Liver cirrhosis cannot be cured. There are treatments, however, which can oftentimes slow the progression of the disease. Complications of cirrhosis can also be managed. This can reduce the symptoms which affect daily living, such as the confusion, fluid buildup, and bleeding risks. Talk with your doctor to learn more.